Our final speaker in this section is Maria Howard, who's the CEO of the Alzheimer Society of British Columbia, and she's going to talk about leading a community of courage, insights from the AD Society of BC. Thank you, Maria.
Good afternoon. I think what I've learned so far today is to not use the clicker. So, no, it's wonderful to be here and to have the opportunity to come and join UBC and present at this really important research forum. There is so much information here, and I think, like many of you, I can still be thinking back to some of the first presentations we heard early in the morning. There's just so much, which is really encouraging. As we all sit together and think about how we can make a difference around Alzheimer's, dementias, and supporting people who are living with this disease. I always like to start my presentations with some basic facts, because what impresses upon me in all my presentations and the presentations at the Alzheimer's Society is as we still hear people asking really basic questions. And so it's always really important to go back and remind people or to let people know who may have the question but may be too embarrassed to ask, that Alzheimer's is one type of a dementia. There are many types of dementias, and I think recently one of the researchers from UVic told me that they looked it up and there were over 300 different types. Alzheimer's is the most prevalent, and it's certainly where our society began its grassroots in supporting families who are living with Alzheimer's. Sorry, I'm wandering away from the mic. But it's important to know that dementia is a progressive disease. It does have a terminal outcome, and so that is why it's so important to be here and be talking about this. As we just heard from Julie, there are some definite myths about Alzheimer's, about it being preventable, being curable, and we need to understand that while we hope that one day it will be preventable and it will be curable, and that is why we are here, today it is not. And so we have to continue to talk about the disease in relation to research, but also in relation to the community of people who are living affected by Alzheimer's. Excuse me, this month in Canada, it's January, is Alzheimer Awareness Month, and our theme this month is called All in It for Alzheimer's, which is really about the idea that we all have a role to support people who are living with Alzheimer's. We are all impacted by the disease, whether that's directly because we may have the disease, or it may be in our family or a close friend or neighbor, or it's in our community. And so we all need to be educated, and we all need to think about how we're going to make a difference here. This is the global problem. What is, I think, really wonderful about the global concept, and I know it's been touched on a little bit here, but many of these great research initiatives, many of the social outreach programs that are happening are global. This is really moving toward a social movement. There are countries around the world who are leading in different elements, who are sharing their knowledge, and we in Canada are able to do that. And this is how we're going to make a change. Because again, while it does affect us in our own background, this is something that affects across the world. And although different cultures are addressing it differently and approaching it differently, we all need to come together and share our knowledge and move forward together. But if we take it closer to home, it's really important to stop and just really, again, look at some of the basic data. The Alzheimer's Society of BC works really closely with the Ministry of Health, and we actually have what's called a Dementia Registry in BC, which actually tracks the number of people who have dementia in the province. Now, this is not perfect because it does depend upon physicians recording data and submitting that, but it does give us a sense of what we're looking at. And we know that over 70,000 people in our province have dementia. And we know that number is growing, and we also know that about 10% of those 70,000 people, so around probably 6,000 to 7,000 people who have dementia in BC are under the age of 65. And so that really is another whole dynamic about what it is like to live with dementia. But probably what Stat isn't here, and I really think I should need to add this to my PowerPoint because it's maybe one of the most impressive stats, at least I think, is that what we also know that in BC, over 50%, probably 60% of people who are living with dementia, people who have a diagnosis of some type of dementia, live in the community. And so when we think about how we are all impacted, what is our role in supporting people with dementia, we know that we are all touched by this. And you will hear people say, I don't know if I've been touched by it, but we all do because we know the majority of people who are living with dementia live in our communities. The Alzheimer Society of BC has a mantra of help for today and hope for tomorrow. And it's really about how we as a society can reach out and help those who are living with dementia to have a better quality of life, to have the support they need, and to be able to make the decisions as relates to their own personal circumstances and to make those decisions early on as possible, as we've heard today. It's also the hope for tomorrow, and again, that is why we're here, because we want to support research. We want to bring families and researchers together to keep moving ahead all these wonderful research initiatives and find a way to actually stop this disease and make it much more tolerable for people. The Society does this in a number of different ways, and I'm going to touch upon a couple of those, but really the idea of the dementia-friendly communities and helping people to have the courage to come forward is what I want to touch on. The Society looks at all elements. We support, we empower people. We do this through our First Link program. We are working to actually educate a number of different groups like we are today, but we also work really closely with educating healthcare professionals, because one thing we've learned in working within care homes and working with a number of different programs alongside the Ministry of Health, many of our healthcare professionals in our province don't actually understand dementia, and they don't understand how to support people living with it, and they don't understand how to support the families. And so that is a really big gap, and we need to work hard to help people to learn more about this disease and how we support people so that we can have a better experience and people can continue to have the quality of life and the inclusion that they deserve. We also need to keep advocating, and it's a political forum, and it's an election year. So for the Alzheimer Society of BC, we are working really closely with the government, and that's just not the Liberal government, but also the NDP, to ensure that people are aware that there are really important policy changes that must happen at a political level in our province to support many of the things we're doing today. And that's not only the programs that we're offering, but it's also on the research side as well. First Link is the program that we offer throughout the province. The Alzheimer Society of BC is a provincial organization. We have offices throughout the province. And one of our main programs is to reach out to families and people living with the disease to ensure that they have the information, the education, and the support they need as they go through the journey, which is always unique to each person and to each family. We have a provincial helpline, our Dementia Helpline, which people can call into to ask a variety of questions that range from, I'm beginning to have some memory problems, what might that mean? I'm going to see my doctor, I don't know how to talk to them. I think we need to start looking about having our parent move into care, I don't know who to talk to. We have a range of questions, and really our goal is to help people start to get the information they need to make decisions. It's really important we encourage people to have the courage to talk about these questions and get the support they need. It is really even more important to ensure that people who are living with Alzheimer's and all the various types of dementia have an ability to share their voice and share what it means for them to have the best quality of life. And I know we work very closely with UBC and the other research institutions in BC to bridge that gap so that people who are living with the disease can share what they need and what is important to them, to the researchers, so they know what to focus on. Because we've heard lots of circumstances where research can focus on things, and then when it comes to people have said, that doesn't really help me. And we've heard that a lot today about how do we ensure our impact is in the right place. It's interesting, one of the things we also say at the Alzheimer Society of BC is that before a cure, you have to have care. And that is, again, really essential. We have to care about what it's like to support someone who's living with dementia before we can get people to step up in a variety of different ways, from resources, financial, from volunteering to support, to focus on a cure. So how do we move people forward and get them to care? And that is what is about the dementia-friendly communities that the Alzheimer Society advocates for. And this is just not an initiative here in our province. This is a global initiative. It started in Japan. It's very alive in many different countries, certainly like the UK. But it's also very alive in British Columbia. And this is about how do we take a community and begin to get everybody in the community thinking about how they care and support people who are living with dementia. And I'll tell you a very quick story. I recently met with the transit police, and they shared a story of one of their bus drivers who had picked up a lady on his route. And when he picked her up, he noticed her from the stop because it was a cold day and she was dressed very lightly. She got on the bus and she sat down, and as he continued to drive his route, he noticed that she was moving around on the bus and sort of going to different seats. But she didn't get off at any of the stops. And so when he was about 2/3 through his route, she was still on the bus. So at one point, he went back to her and said, "I've noticed that you've been moving around a lot on the bus, and I'm wondering if you want to come sit closer to me at the front where the seat is probably more comfortable." So she did, and she moved up closer to the bus and sat with him as he continued to drive his route. She still did not get off the bus. So he actually called into his dispatch and said, "I have a lady on the bus with me who got on at a certain stop. She looks like maybe she's not completely aware of what's going on because she's not dressed too well, and she's been moving around the bus and she hasn't gotten off. And I'm coming up to where she got on the bus. I remember her stop. So I think that someone should come out and meet us." And so the transit police came out and met them at the stop. And when they got to her original stop, they came on the bus and they said to her, "We wonder if we can help you get to the stop you're going, because the bus drivers noticed you've been on the bus but you haven't got off." So she got off with the transit police at her original stop, and through some really just comfortable conversations, they were able to learn that she lived nearby, and they got her back to her home. And that's a dementia-friendly community. And I get choked up about it because that's people who care, who make a difference for that lady. And that is what we need to get our community to do so that people can begin to start to think about their roles and care. And that's where the starting effect to where we get people to volunteer, to put funds into research, to be willing to stand up and share their story and be a leader. And a community for dementia friendlies doesn't have to be a big community. It can be a little community. We work with a number of different communities, from the cities to libraries to book clubs. Every community defines itself, but they can think about how they can support people who are living with dementia and the caregivers who are supporting people to feel supported, to be feeling a part of that. Everybody has a legacy, and everybody wants to feel like they can continue to contribute. And a dementia-friendly community recognizes that and sees the person before they see the disease and thinks about how that person is still giving back and feeling engaged. The dementia-friendly community that the Alzheimer Society has been working on has been a really exciting initiative. We've had so many partners join us. We've been looking at supporting people, and this is the idea that we are all some type or some way connected to dementia. We are all dementia friends. We've looked at policy. We've been working very closely with a number of cities like the City of Vancouver, the City of New Westminster, who are very committed and dedicated to formalizing this in their cities so that people actually have policy that supports them to live a better life. And it's around practice, because there are a number of professional organizations who work with clients and families every day who are struggling with dementia. And so if we can help those families begin to think about, or those professionals think about how they can help those families, they can actually begin to have a better experience when people can have those discussions. Our Municipal City Toolkit is something that we've designed, and we're really excited because now this has been picked up in some different cities around the world. And that's, again, about how do we think about how we move forward. A Dementia Friend, we have a national campaign that is happening. I encourage people, if you have not heard about this campaign, to go to dementiafriends.ca, and it's about how each one of us can make a difference and commit to helping move forward the idea of supporting dementia. And one by one, as we become a Dementia Friend, we can make a big difference. It takes a lot of commitment, and Paul and Linda Blanchett, as you will see in this photo, are a family who are living with dementia. Linda is in her 50s, and she is still trying to give back into her community and still be a part of it. We have to continue to support people so that they feel like they are making a difference, and they can help educate a number of different people who actually we still hear say, well, I don't have anything to do with people in dementia. We all do, and whether that's youth in a school or people on a bus, we need to help people see the way that they can make a difference through education. It takes a number of different partners, and that is what we're doing here today. I know a number of you have come here because you're interested, but you are all also have lives and you have professions and you have connections, and so you can make a difference by thinking about how you go and spread the word of what we're talking about. And definitely it's about flexibility, because everybody has to experience this in their own way, and we want to ensure that people continue to do that. So as Lynn walks up here, really Jim Mann is our advocate and wants to share how we want to help people like Jim and his fellow people who have dementia feel included and really a part of the community. And so there really are some very simple things in my ask today, like we've been talking, and I think it's a wonderful way of finishing the forum, is that when you all leave today, I would ask that you go out and share what you've heard today and learned today. And I would ask that you share that not just with someone who is also interested, but somebody who may not think that this is something that they would want to participate in next year or listen. Because by sharing the word today of what you've heard from the research side about how we support people, we are going to move this forward. And through a care and through a cure, we're going to make a difference. So thank you very much. I'm really pleased to be here.